Good morning, Mr. Chairman and members of the subcommittee. I am Robert Vito, Regional Inspector General for the Office of Evaluation and Inspections at the U.S. Department of Health and Human Services Office of Inspector General. Thank you for the opportunity to testify about CMS oversight of Medicare contractors. 2 years ago, I testified before you about recurring problems that we had identified with CMS oversight of benefit integrity contractors. CMS relies on contractors to administer $500 billion in Medicare spending every year. OIG understands that effective oversight of Medicare contractors is continuous, demanding, and often resource-intensive process for CMS. Unfortunately, some of the same problems we identified in the past with CMS oversight of benefit integrity contractors also extend to other CMS contractors. Today, the OIG is releasing 2 reports that highlight similar oversight problems with Medicare Advantage and Part D. The OIG has found that CMS does not leverage data to improve oversight, does not investigate variation in data across contractors, does not address underperforming contractors timely and require corrective action plans, and does not share information with beneficiaries and other stakeholders that could assist anti-fraud efforts. Since 2008, we have repeatedly recommended that CMS require Part D plans to report fraud and abuse data. Rather, CMS merely encourages Part D plans to voluntarily report these data. Under this voluntarily reporting system, less than half of the Part D plans have reported data, and the reported data have varied significantly across plans. Due to CMS's failure to investigate variation among plans, we do not know if the plans are reporting incorrect data, have ineffective programs to detect fraud and abuse, or lack a common understanding of what constitutes a potential fraud and abuse incident. Further, without detailed information on fraud and abuse incidents, CMS is missing the opportunity to discover and alert plans and law enforcement to emerging fraud and abuse schemes. CMS has also made use of Part C data to oversee Medicare Advantage plans, despite investments in contractors' review of the data. The Part C reporting requirement data are a significant resource for oversight and improvement of Medicare Advantage. CMS has implemented regular and intensive reviews of the Part C data through its contractor, but conducted minimal follow-up on the data issues that it identified. For example, CMS has not determined if outlier data reflected inaccurate reporting or atypical plan performance. CMS also has not used its contractor data reports and analysis to inform the selection of plans for audits or to issue compliance notices for performance concerns. This would be like taking your car to a mechanic, having them run diagnostic tests, and then not using the test to determine if your car is running well and safe to drive. Our review of the MAC administrative contractors found that CMS performance reviews of MACs were extensive, but were not always timely. And even when CMS identified quality standards that were not met, CMS did not always resolve the problem. There were 2 MACs that consistently underperformed, but these MACs had their option years renewed. Lastly, CMS is missing a critical opportunity to enlist millions of Medicare beneficiaries in the fight against fraud. MACs mail Medicare summary notices, or MSNs, to beneficiaries to show them what Medicare claims have been paid on their behalf. These notices can serve as a key fraud and detection tool when beneficiaries identify and report suspicious information contained on their MSNs. However, the OIG found that over 4 million notices were not delivered to the beneficiary. Further, CMS has not instructed MACs on whether or how to track or follow up on undelivered MSNs. It is critical that MSNs be timely and appropriately delivered to beneficiaries. If just one beneficiary sees something suspicious on their notice and reports it to Medicare, it may lead to a fraud case that saves millions of dollars. In conclusion, the OIG recognizes the challenging job CMS faces in the oversight of its contractors. OIG has recommended actions that CMS could undertake, and now CMS is considering some of these recommendations. Thank you again for your interest in this important area and for the opportunity to testify before the subcommittee today.